Representative Mann.
Thank you, Madam Speaker and members. I would like to speak to you today not as a politician, which I will soon no longer be, yay, but as a frontline healthcare provider. And I want to start off by saying that we are not okay. We are struggling to take care of you. We are struggling to take care of your family. Generally, when I walk into the ER, there's about 20 to 30% of patients that have this yellow light next to their name, indicating that they either have COVID-19 or they potentially have it. My last ER shift, I walked into a full ER where every single patient, except for one, had a yellow light by their name. Our ERs are full. Our hospitals are full. In Rochester alone, COVID-19 hospitalizations have tripled in the last 2 weeks. And I want to share with you conversations I've had or I've heard regarding this in the last couple of weeks. And they're just excerpts of conversations, so you can imagine what the remainder of the conversation looks like. If we can't find this patient a bed for his surgery, then we will do what we have to save his life by doing an emergency high-risk surgery at our rural hospital that we have no business of doing. It's either that or he goes home to die. Another similar excerpt. But if we don't find a bed, then what? She goes home to die? Well, yes. I watched a physician sob after she told the wife of a dying patient that her husband of 65 years would not leave the ER alive. I watched as a son asked one of our nurses if she could go into his dad's room and put her hand on his shoulder and tell his dad that he loved him. As this patient died alone because his son also had COVID-19. You can swear up and down that COVID-19 is not a big deal, that it's mild, that it is not worth your personal freedom. You are wrong. You will know that you are wrong when, because of COVID-19, your child will have to wait in the ER, writhing in pain for 6 hours because of a broken leg. You will know that you are wrong when your spouse has to wait to be seen while having an asthma attack. You will know that you are wrong when your brother or your sister is faced with waiting 8 hours for an urgent abdominal surgery. And you will know that you are wrong when someone you love has COVID-19 and there is no medical staff left to take care of them. Now, I know that science has historically not been the forte of several House members, but correlation is not causation. We are doing far better than many states, most of which have not done anything, haven't even done something so simple as a mask mandate. And one of those states now, North Dakota, is at a crossroads, and they are allowing COVID-19 positive nurses to take care of COVID-19 patients because so many people are sick and their healthcare system is completely overwhelmed. I ask you, is that where you want Minnesota to be? Because that's where we are headed. The Mayo Clinic, as a national system, has over 1,000 staff members not working because of COVID-19, and the vast majority of them came into contact with the virus out in the community. We are not okay. This isn't even a question about whether or not we are in a state of emergency, because unfortunately, we are more than ever in a state of emergency. And instead of focusing on that, instead of working together, which we have every opportunity to do, to work together to make sure that people won't get evicted, to do things like extend the availability of using your insurance without new deductibles in 2021 so we can push back elective procedures, to make sure that healthcare workers have enough PPE, which once again we don't. to make sure that we are providing continued relief to those who have lost their jobs, we are having this ridiculous conversation again about how much power the governor has and how it personally hurts your feelings. We have staff in this building who have family who died. We have staff in this building who have family in the hospital today. And yet several of you still don't have the decency to put on a mask. The simplest act of humanity towards someone else, and it's too much to ask. Well, I will tell you that recently a letter has gone to the governor from over 400 healthcare providers in the state of Minnesota, asking for more restrictions because we can't keep up. We can't keep doing this if everyone doesn't pitch in. For example, Representative Scott, you gave great examples about why your kids should be in school, and I 100% agree with you. And yet, what have we done to keep those numbers down? We allowed youth sports to continue, making masks optional in those circumstances. We have allowed in-person dining, despite the fact that this is one of the most common places to get COVID-19. We can't have it both ways. So I am urging you today, I am begging you today to focus on what's important. We need to fight for the whole, because as individuals, we will not get out of this. The healthcare providers in Minnesota are begging you to stay at home and take this as an emergency and take it seriously. Thank you, Madam Speaker.